Good afternoon. My name is Sean Henry. I'm a senior at SUNY Cortland, criminology major, and I'm here to discuss ways to help those with mental health issues. Types of mental health issues. We have clinical depression, anxiety disorder, bipolar disorder, and schizophrenia. I only listed these four because these are the types that I personally researched and encounter with my career for youth suffering from mental illness. This graph is courtesy of SAMHSA, where I got it from the New York Times. It's easy to read. As you can see the demographics here, the white population and black population and Hispanic population are the most prone to mental health, and females of 24 and below are prone, and also 16.3% of males. Over here our age category, our race, ethnicity, or our demographics, and these are the percentage, and this is from 2019. Self-care solutions. This is anything that you, me, can do to identify early warning signs within ourselves or help deal with those issues. Limit alcohol consumptions, drinking more water throughout the day, read positive posts, articles, books, movies, anything that interests us but also are positive. Limit social media usage or screen times. Walk or jog in a peaceful setting. I personally like walking around the block to kind of clear my head. Sleep or meditate when you can. You should be getting on average 7 to 8 hours of sleep. I understand if work comes first, but you want to get at least 6 to 7. Institutions improvement. When I mean life coaches, I don't so much mean guidance counselors. Life coaches are more of when you get out of the high school stage. They should be free access to the public as mentors and role models. When we go to guidance counselors, we seek them throughout high school, not with just scheduling classes. They need to be there to facilitate emotional needs. Employment centers, finding careers for young adults after they get out of high school or if they pursue college, and then rehabilitation centers designed for youth. Um, there's many centers for pediatrics and adults, but there's not a lot for youth or appeals to youth. Youth from 14 to 24, uh, they don't tend to think that there's a lot out there for them. And for the United States, we're lacking as a whole in that. Community improvement. When I mean that, I mean hospital reform, county jail legislation reform, social services advancement, chemical dependency push, and homeless shelter reform. Now going back to county jail legislation reform, what I mean about that is that mental health should never be punished just because they're mental health. Um, our jails aren't fit for that, and nor do people deserve to go to jail because they're suffering from a psychological condition. So that correlates with hospital reform. Where can we get these people to get treatment, get the help they deserve, and in a facility that's designed around their care plan? Conclusion. Um, this is anything that you or me can do to help solve issues within our community. We identify people that we believe are a person in need of help. We need to listen to them and hear them out, hear their story, then give them the options. What can we pursue forward? We need to be patient but supportive. And then also, if we can't identify anybody or no one's really seeking help, donate and help spread awareness to a certain cause dealing with mental health. That is my conclusion, and I thank you for viewing this video.